I want to make this video as kind of a comprehensive video on the use of manual evacuation for the clearing of stool from your rectum and anus area. From this point forward, I really don't care much for the word anus. I prefer to use the term brown-eyed girl. It's just my little term of endearment, so to speak. You will find that I am not uncomfortable at all talking about these things, and that's just a word that I don't really care much for. I find it very clinical. So from here on out, we will be calling it my brown-eyed girl or your brown-eyed girl. Let me first start by saying that everything in this video has been approved by my own doctor, that being my colorectal surgeon. If you are going to follow any of the guidance that I'm going to set forth here based off of my own individual experiences and what I perform in my own life by the approval of my doctor, it is imperative that you also get your doctor's approval for performing any of these tasks. I will do my best to tell you how I have managed to safely perform this act on myself for over a year and a half now, and hopefully it will get you prepared for, if you're not having to do it now, you may have to do it down the line, and may give you some helpful tips if you are performing this, maybe some different ways that you can do it. So now that I've got that out of the way, that I'm not a doctor, none of this is to replace any doctor's guidance on your part. Basically, I can't be held liable for any damage you may do to yourself. I haven't done any damage to myself, as I follow quite a few safety rules, but there are ways that can be done. And so proceed with caution and your doctor's own approval and advice. There's really several ways in which you may find yourself having to perform something like manual evacuation, whether you deal with situations like I do, where much of the time I suffer from neurogenic bowels, which is basically the loss of the nerve signal that causes your system to have motility or move. I also suffer from, and excuse me if I get the words turned around, Obstructive Defecation Syndrome. Much of the time I feel as if I have a golf ball up my booty. It can be incredibly uncomfortable, and so there's a lot of times where there's several times during the day that I will don my personal protective equipment and do an inspection of what may be going on. So I'm going to go over basically what I carry in everyday life, what I have at home, and how I store that so that it's not obvious to anyone visiting my home, but it's still within reach. The worst part of it all, in my opinion, disposing of the evidence, as I really don't want anyone to ever know what's going on. And basically, some of the things that could happen if you weren't using this technique to basically clear any impacted stool and you were trying to do it on your own, that kinds of things. So basically what we want to do, what the purpose of manual evacuation is to clear impacted stool from the area between the rectum and our brown-eyed girls, and also to prevent damage if you do find yourself in an impacted stool situation and you are a patient like me that doesn't have any feeling in your brown-eyed girl and perineum area, and so it's imperative that you kind of do this to prevent things occurring like fissures, hemorrhoids, fissures which can turn into what's called a fistula, which will require surgery if you end up in that condition, and hemorrhoids, both internal and external, skin tearing, just a litany of issues that can arise from having stool impacted in this area. So basically, what I want to talk about first is assembling your actual kit. What I use, the reasons why I have selected some of the things that I have, and I have both an at-home kit and a travel kit. So the first thing I'm going to go over is the travel kit, and some of the things will overlap here. First of all, I always have gloves with me. Now, gloves, you have a couple of different choices. I like to use the what's sometimes called the nitrile gloves, and excuse me, but this is just the package. I tear the tops off to make them more accessible. And these gloves are stronger than most gloves. And when I don the gloves, I'll show you some of the features that I like about them. I have had bad luck with this type glove, which is basically a disposable multi-purpose latex glove, and it'll even say lightweight hand protection. I have found them to get holes in them at the most inopportune times. They are a bit cheaper, and honestly, I do use a lot of gloves, but I've just had too many bad experiences using these because they are not as strong. The next thing you'll need for your kit is lubrication. Lube, no matter what. For my purse, I like to carry the smaller tubes. These are like 88 cents at Walmart, just the small off-brand KY jelly. Wipes, which are imperative. For traveling, I use the smaller wipes, and what I do is I'll have a bag that doesn't have very many wipes in it, and I'll put that in my purse. The gloves and the lube, I always have a purse that has a zipper pocket, and they will stay in there. So as long as I have a bathroom to go to, I can go in and I can inspect, and if I have to, perform a manual evacuation on myself in the restroom. Now at home, my supplies are a little bit more involved. I actually prefer these type wipes, which are actually considered washcloths. Walmart is the only place I've ever seen these. They sell them back in the area where the adult diapers are. You can buy them in the individual packs, or you can buy them in a bulk box of 3 packs for something like $5 or $6. What's great about these is the size. They are 12 by 8. So you've got a great size here as compared to a normal wipe, which is about, you can see the difference here. These are very strong and durable, and I have a million uses for them. Something else that I have for at home is I purchased these little tiny baggies. I think I actually got them at the Dollar Tree, but these are great to put basically all the evidence of what you've had going on in the restroom, so that you can dispose of it in a hidden place. Because really, that's the worst part for me, is I don't want anyone to ever see, what my used supplies are. At home, I prefer a pump type lube, and this is just the off-brand lubricating jelly for KY. What I'll actually do is I'll actually transfer the 88-cent tubes to this, just because I am incredibly frugal. And I think this bottle runs somewhere from $2 to $3, whereas the tubes are 88 cents a piece. I hide my gloves in a little makeup kit, and on the back of my toilet I have a little basket, and so I have my gloves in here and nobody can tell what that is. I'll have my wipes out because most people don't think anything about wipes being around a toilet. And as far as my lubrication, I will have it, I have a little basket in front of my toilet where the toilet paper hides, and so I'll keep my little baggies and my lubrication there. If you do not like KY jelly, you can use a cream-based product. I would not recommend using lotion. It has alcohol in it, which can be drying, and a lot of this has to do with sensitive skin, sensitive numb skin at that most times, and so you really don't want to increase any kind of dryness or anything. Also, Vaseline works well. Anything that is going to make sure that you've got good lubrication of the area. And so basically, when I'm going to actually perform this, I consider it what is called gloving up. And so the first thing I'll do is I'll actually don my gloves. Now these are the nitrile gloves. I prefer these because they have a bit of texture on the end of the fingertips, and I find that to be very conducive to helping do what we have to do. I will take some lube and put a pretty good amount of lube on this one finger. I do recommend that the first thing you do is actually take the lube and kind of rub it around your brown-eyed girl, because some people, the mere act of stimulating the area will cause to help them have a bowel movement if you're having issues with that like I do. And so, if you'll just rub all around the area in a circular motion, you may actually be able to accomplish moving your bowels on your own. Of course, you're going to advance to that point and actually use the glove finger to actually enter the rectal area. And I've tried to put a nice little diagram up for you because truly I didn't really know the difference in terminology, but the rectum is internal. And if you ever go to maybe practice this before you actually need it, and you actually go up and inspect what's going on in there, you will feel your rectal area, and sometimes you can actually feel stool exiting that area. And so, basically, I find that it is much easier to perform manual evacuation when your stool consistency is in a constipated state. The firmer the stool is, the easier it is to remove. There is nothing worse than trying to remove impacted stool from this area in there with a gloved hand. It is almost impossible. I can give you a million different colloquialisms to describe it for you, but until you actually go through it, you won't know what I'm talking about, but it can be almost impossible. And I'm convinced if I could actually devise a tool that you could safely use for these situations, that I would become independently wealthy for the amount of people that probably have to do that. I keep myself constipated, and my doctor agrees because I do suffer from fecal incontinence. I have good control of my sphincter, but for whatever reason, there are times when the stool just takes on a mind of its own, for lack of a better word. It's very strange. There's times when I feel like my system's almost under a vacuum, and so things that I should be trying to get out will actually almost reverse back up into my system. It's very strange. If you have Ehlers Danlos Syndrome like me, you may actually develop what's called a rectocele, which is a pocket or outcropping due to the weakness in tissue between the rectal wall area and the vaginal wall. And in extreme cases, it can even impact your bladder just from the force. And some women actually splint their vaginas to help with manual evacuation. There may be times, especially when you come out of surgery, where you find yourself completely impacted with stool. And that's one of the cases where you want to, try and follow this protocol, because otherwise you could end up with a fissure or hemorrhoids or tearing of the skin. And, basically a fissure is a tearing of the skin, but it's a tearing of the skin around your brown-eyed girl, your anal sphincter. And, fissures can develop into a chronic condition, especially if you continue to stay in this situation, and actually develop into what's called a fistula, and that requires surgery. I have actually had to have that surgery years ago due to these kinds of issues. It is not fun, and that's why I always say you can't have too much lube. There's no such thing. So, lube, all you can. That's here. Reasons for lube are to prevent fissures, hemorrhoids, both internal and external, and skin tearing. That's just in general. And I've tried to kind of make my own little diagram here of how, the rectum, the internal rectum, everything plays into, this area is going to be where you're going to gather the impacted stool. And, since you're completely numb, you're not going to feel that necessarily until, you may actually have to put a glove on and see. Now, when I have finished removing as much stool as I can, one of the things, of course, is cleanup. It is the most embarrassing part of it all. And so I find the best way to do that is to actually take a wipe and kind of put it around the area where I've, it's been exposed to the fecal matter. Kind of wrap it around, make a fist, grab my glove underneath, and slip it over while holding the fist and trying to keep all this in one fell swoop. And then I will use these bags to capture any wipes that I've used, because most wipes are not septic system or sewer system safe. And not only that, they will clog your toilet in a hurry. And so I use these little bags to kind of put everything in and then throw them away in my kitchen trash or somewhere where the trash is kind of hidden and it's not going to be in plain sight. And of course, now that I'm trying to do this, I can't get it open. But basically, I just put my wipes and everything in here and kind of dispose of it later on. Some of the terms that are associated with these types of problems that could, involve you having to perform manual evacuation are neurogenic bowels. Is what I suffer from. It's spotty sometimes. I do have the nerve signal come back every now and then. But a neurogenic bowel is basically the loss of the nerve signal that causes the motility motion in our colons. When I have this happen, I have no signs of movement, no gas, no cramping, no gurgling. I have no indication that anything's actually moving. You've got the rectum, which is internal, the anal sphincter, impacted bowels, fissures and fistulas. And I've tried to kind of do my own little hokey diagram here, and hopefully this will show up for you in the meantime. There's a good chance you may wake up from surgery being numb in this way, and you're going to have to perform this. And so, you may consider actually practicing this and seeing, how difficult it is. When I first started having to do this, it was quite overwhelming, dehumanizing. Just one of the worst things I had to deal with. But now that I have a pretty good plan for how to manage it both in travel and at home, it's really become second nature, and it's not that big of a deal really in my everyday life. I hope this has been informative for you. If you have any pointed questions, please let me know. I've made great progress in the last 3 or 4 months. I credit my Reiki with all of that. Yes, the nerves are still healing. We have to give up to 2 years for that. But I've had better results in the past 4 months than I did in the first 9 months after surgery. So just remember, if you're going through this, especially if you didn't have it before surgery and you've developed it after surgery, more than likely it's just going to be a temporary condition, and once your nerves heal, it will go away. But you get used to it, and you just kind of handle it and go on and hope for the best, because progress is always progress, and there's really no reason to lose hope at this point. I hope you have a great night, and